So hi everybody, good evening. Welcome to the June National Grassroots Conference Call. Really hoping that all of you are safe and you're well during the continued lockdown. It's really good. I've really been looking forward to catching up with all of you, and as we were just discussing, it's really nice to see everybody's face on the screen, particularly this month. It is really a shame that we can't meet face to face, as I know many of us would have done if we'd been able to run our national conference as usual in June. A little bit later on in the chat and the conversation tonight, we're going to talk you through our revised plans for that. Before we get into that though, if we've got anyone new on the call this month, a particular welcome to you. My name's Aaron Oxley. I'm the Executive Director of Results UK. This is our monthly conference call for our volunteer grassroots advocates from all around the UK. Would anybody new like to introduce themselves? It's not compulsory, but it's always lovely to be able to welcome new friends and hear why they're interested in this work. Do we have anyone new?
Hi, yes, my name's Cameron.
Hi, Cameron. Welcome.
Hi, thank you.
Glad to have you with us.
Where are you, Cameron?
I'm in Edinburgh.
Well, welcome.
Nice.
Thank you.
I love Edinburgh. Wonderful, wonderful city. Do we have anybody else new that wants to say hi?
Hi, yeah, my name's Sam. I'm in Sheffield.
Hi, Sam. Lovely to meet you too. Spent some crazy nights out in Sheffield. That's also a lovely town. Any others wanting to say hello? No? Okay, good. Well, look, welcome to both of you. So let's kick on with the rest of the call. Now, later on, we're going to be hearing from an expert speaker on the topic of this month's campaign action, which is the important role the Global Fund to Fight AIDS, TB and Malaria has in the current COVID-19 pandemic response. But before we hear more about that, I want to make a few introductory remarks about the context for our advocacy at Results. Then we'll hear some updates, then we'll go over to our speaker and get into asking him questions. So first of all, I want to start off by talking about safety. As you know, the government's talking about an easing of the lockdown in the UK. And of course, we're taking note of all the official advice and the way that we're working at Results. Now, at present, our staff are still all working remotely. All the meetings we're having with politicians and civil servants, they're also happening remotely. And we do expect this to be the case for quite a while yet. Now, obviously, this presents quite a few challenges, not the least of which is the parliamentarians' very understandable focus on the crisis here in the UK. But rest assured, we're able to continue to work effectively and safely, even if we do have to work a bit harder to get people's attention. The key thing in that previous sentence is about safety. And we're continuing to make safety our #1 priority for both our staff and for all of you, our volunteers. We're assuming that we won't be running any face-to-face activities for a while yet, and that your group meeting and activities are also going to continue to happen virtually. So good thing you're all becoming Zoom experts. Now, the impact in our country of COVID-19 is really obvious to us, and yet in countries without the ability to monitor how many COVID cases there are, and its effects on people with pre-existing conditions such as TB, HIV, malaria, or people whose immune systems have been compromised by malnutrition, the data is really very patchy. We don't know what the full effects on society will be in the longer term, though of course we can make some pretty well-informed guesses. What we do have information on, however, is the impact on people's lives right now in places where there's no safety net, where food markets are closed, and where many people are struggling to live and to adapt proper social distancing. Now, some of you may have heard us mentioning that as well as working with volunteer advocates here in the UK, this year Results has also been working alongside some partner organisations in Ghana, Sierra Leone and Tanzania to support volunteer youth leaders who are advocating for stronger health systems in their countries, particularly in relation to malaria. Now, shortly after attending a training event at Addis Ababa earlier this year, that's when the COVID pandemic hit, which turned all of those youth advocates' plans and of course their lives of their communities upside down, just as it has here, as the virus spread rapidly around the world. But each of them has risen to the challenge, just as you have, and they've replanned their advocacy with many online activities such as social media, blogs, other media work, reaching out to community leaders, health officials and policymakers, engaging new people in conversations about the importance of robust health systems. So I'm going to quote from 2 of our 10 youth leaders in Tanzania who've been documenting their activities and how their communities are feeling the effects of the pandemic. Now, Dorina Mathayo, who operates in Mwanza region of Tanzania, has chosen to be optimistic during the crisis. She's planned to undertake some youth development activities aiming to create linkages between youth and private sector, but these were halted due to the pandemic. So she's unfortunately also been unable to work due to the limitations on community activities, and this has led to a fair amount of distress. However, she chooses to be positive, learn and unlearn, as she put it. And according to her, this is the right moment to apply her leadership skills, and she's been sharing her knowledge and experience of advocacy with her friends. Now, another youth leader, Farhan Yusuf from Dar es Salaam in Tanzania, has a very strong passion for mental health. He notes that this pandemic is affecting the mental well-being of all members within the community, from students missing school and interactions with their peers, through to business owners concerned about the impacts of the pandemic on their livelihoods. Farhan uses online media to create awareness about the importance of mental health and is engaging others in discussions about the pandemic, its implications on health system and other sectors, and particularly the damage being done to gains that have previously been made in Tanzania in beating malaria. Lastly, I want to quote one of the youth leaders in Ghana, Lucky Soglo, who's written a blog post about his work advocating for increased domestic resources for enhanced health systems in the fight against diseases, including malaria and COVID-19. He's been spending time getting to know what it's like to be a health worker during these challenging times by volunteering with our advocacy partner, Hope for Future Generations in Accra. He's been visiting health centres in Western Ghana, modelling social distancing, and hearing the experience of senior nursing officers, doctors, and community leaders. One doctor who had come out of retirement told him, "We are at the end of our strength. We do not have sufficient resources, and especially staff, because apart from everything else, the staff are beginning to get sick." Now, we're going to post the link to that blog post in the chat box, and also a link to our Ghanaian partner organisation, Hope for Future Generations, and to the online activities of the Youth Leader Programme. All these links will be up on our website when this call recording is posted up later this week, so you can grab it there as well. And we just really hope that you'll find all of these testimonies useful and inspiring. The youth leaders, just like us here in the UK, are proud to be working at the heart of global efforts to help our communities and neighbourhoods recover from this pandemic and come out more resilient than before. Now, lastly, I just want to mention an event that's happening this Thursday. It's the Global Vaccine Summit. It's being hosted by the UK and is a chance for the international donors to pledge resources to Gavi, the Vaccine Alliance, whose work will be absolutely critical in the coming years to deliver the routine immunisations needed to protect us from a whole range of preventable diseases, such as measles, which is threatening another resurgence right now in part due to COVID. And ultimately, when a COVID vaccine is developed, Gavi's work will be absolutely essential to making sure that that vaccine is available to everyone, no matter where in the world they live. Once again, we're putting a link to all of this in the chat box. You should be able to follow a live stream of the event and hear what's happening firsthand. And while you do, you can feel proud of the leadership the UK is showing in hosting this conference. You should also feel proud for the big UK pledge that so many of you helped secure. If you can make the live stream, do enjoy that victory and get excited about what Gavi will achieve. Now, that's all I want to say right now. So I'm going to hand over to Della for the usual roundup of your advocacy activities across the UK in the last month. Over to you, Della.
Thanks, Aaron. Nice to see you all. I'm having some really crazy roadworks outside, so I'm sorry if there's a bit of background noise. I think they're digging up the whole tarmac outside my house. But yeah, I'll start with just a small update on the May campaign action, which was to write letters to the editor of your local media outlets on the impact that COVID-19 is having on other preventable diseases and why our response needs to be part of a global movement. It's been really nice to read all the letters that I've seen so far. They've been amazing. I've compiled a little thread on our closed Facebook group, just so that you can kind of share learning and have a look at what you've all been doing. Maybe I'll screen share and quickly show you. If you're not in the closed Facebook group, I will post a link so that you can join. So yeah, you can see the first one here is Karen in Macclesfield's cross stitch, which she sent in to her local paper along with like a written piece, which was published. So congratulations, Karen. And yeah, there's various different bits from different groups. You can take a look by yourselves if you like. I'm gonna stop share. So yeah, thanks for all the work you've put into the campaign action. It's been really nice. So far I've heard that Brighton and Manchester have both collaborated on joint letters, which is awesome. And Macclesfield, Poole and Lithgow have also had letters that have been published as well. So amazing, congratulations. Does anyone on the call want to share a little bit about how they found the process, if there's anything they've learned? No pressure.
I just want to say, I put in the chat, this is Pete at Stork Valley, that we did get a letter published in the local paper, but I haven't got a copy because I haven't been out to buy one. Sorry about that.
Don't apologise, Pete. Definitely safer to stay indoors, but you can kind of have the peace of mind that you know it was published, so well done. If you do manage to get hold of a copy from someone else who may have seen it, it'd be really nice to see what you came up with. But
Well,
yeah.
I've asked the editor for a copy, but he
Oh,
hasn't.
you have? Okay.
And,
Let us know if you get it. I'd love to read it.
Yeah.
Thanks, Pete. Anyone else want to jump in and say how they found the process? No? Okay, that's fine. I'll move on and hopefully you can read each other's letters and get inspired for the next media action. One thing I wanted to add on that is if you haven't been published yet, or you're not sure that you will get it published, don't forget that you can self-publish on sites like Medium or on your group blog site so that your writing can be shared with others. And yeah, just try multiple different platforms so that you can get the most out of the work that you put in. I know some of you have been published in university publications and religious publications as well. So it's not just local media, you can keep trying with other platforms. Yeah, so on to this month's action in June. So we're asking you this month to organise online or phone meetings with your MPs. Aaron will talk a bit more about it later. But this time is especially exciting because it's going to be running in parallel as a kind of week of action alongside results in the US. So we're asking you to hold those meetings between the 22nd and 25th of June so we can build some momentum and do it at the same time as our US partners. And hopefully you'll find that really motivating. To amplify your voices even more during the week of action, it would be amazing if you can take screenshots of your MP meetings, if you do them over Zoom, or you can ask your MP for a quote that you can share on social media, which is really nice material to help spread your message even wider. Also, some of you probably know about this, but we have a kind of global results hashtag, which is hashtag voices for results. So if you search that on Twitter, you can see what other advocates are up to all around the world, which is really nice. So yeah, do use that hashtag if you're posting about your activities. I'm going to put a link in the chat as well for what's called a Twitter wall. So it means even if you're not on Twitter or social media at all, you can kind of follow what that hashtag is doing. So you can see what people are posting about around the world. So yeah, hopefully you enjoy that and make the most of it. So yeah, the week of action I mentioned will follow on from the international conference, which our US partners are organising, which happens on the weekend of the 20th and 21st of June. They've got loads of amazing sessions planned and they're all online this year. So yeah, would really encourage you to register and get involved. We're helping organise a session which is called Open Caucus, Learn How to Influence Elected Officials or Grassroots Advocates Around the World. It's a long title, but it does what it says on the tin. You'll get a chance to discuss with other advocates in partner countries and learn from them a little bit. So it'd be really nice to see some UK representation in those sessions. It's just a half-hour session that's being ran twice. So at 12 noon on Saturday the 20th and 2 p.m. on Sunday 21st. I'll put all the details in the chat box. There's loads of other great sessions on the agenda as well and amazing speakers. They're also running a workshop on writing letters to the editor. So if you would like to build on the experience you've gained this month, that would be really handy. Just remember that on their website, the agenda is in Eastern time in the US. So we are 5 hours ahead. So you need to convert those timings so that you can show up in the right place at the right time. You can register now, either for free or you can make a donation to Results in the US. I'll put a link in so that you can follow the steps. But if you're having any trouble, you can get in touch with us and we can help you out with that. what else? Our national conference, which was supposed to be happening, I think this weekend, was obviously postponed because of COVID. So it's still going to be held on the 12th and 13th of September, but it's going to be a completely online event. We've recently decided, just I guess for obvious reasons, but it would be great to see as many of you show up as normal, maybe even more of you, because you don't need to travel. So yeah, we'll hopefully be able to get together in person maybe later on in the autumn, but we'll keep you updated. And I will share a link for registering for the conference when there's one up and running. There isn't one just yet. So the last but one thing I wanted to mention is that we're looking for a grassroots trustee for our board, which means one of you guys from the network can represent the interests of the volunteers and advocates on the board level. It's a really good opportunity to inform our strategic vision. If you're interested, there's a kind of role description on our website, which I'll post a link to. You need to nominate yourself, and then we will have the opportunity to vote as a network for who you would like to represent you on the board. So yeah, it's a really good opportunity. I would encourage you to think about it, even if you've never considered becoming a trustee before. I'm also going to put a link in the chat box to the latest news flash that we sent out on our mailing list in case anyone missed it. There's a really nice blog from Sidonie and Brighton there as well, so do check it out. I think that's everything I had to mention, so back to you, Aaron.
Thanks so much, Della. Let's jump straight into the topic of tonight's call. It's my really great privilege to introduce you to Mike Podmore. Mike's been with us since the start of the call. He's the Executive Director of the STOPAIDS network, and he's somebody that I've worked very closely with for many years, and particularly in relation to our joint advocacy around the Global Fund to fight AIDS, TB, and malaria. And I really can't think of a more well-informed person to be discussing a topic that we have this evening. Mike, welcome.
Thank you. Thanks, Aaron.
Great. So, Mike, thanks so much for joining us as our expert speaker tonight. You can see who you're joining. They're our monthly, it's a monthly grassroots conference call. We've got a network of volunteer advocates and campaigners from right across the UK. Some who have been active on global poverty for many, many years, and some, as you saw at the start, who are brand new to results. Of course, everyone here is really keen to hear about your experiences of advocacy, particularly around infectious diseases and the dual epidemics of TB and HIV. I know we've done a lot of work on that. And in particular, the role of the Global Fund in helping to deal with the additional risks posed to its programs by COVID-19. But before we get to our first question, I'm going to ask you to say just a couple of words to introduce yourself and what you do at STOPAIDS, and really to say a little bit about what got you into this work and this particular aspect of the fight against global poverty relating to HIV.
Sure. Firstly, thanks very much for inviting me to join your call. It's really exciting to see all your faces, and I've had the pleasure of coming along to, I think, I don't know, it was last year's results conference, and that, I really enjoyed that. Yeah, it's great to be here tonight. So thanks for inviting me. So I'm director, as Aaron said, director at STOPAIDS, and we're an advocacy network, a lot like Results, actually lots of commonalities. And as Aaron said, we work really closely together on a number of different topics, the Global Fund, on things like sustainability and transitions, and broader health. I also, recently, about a year ago, we took on hosting another similar sort of network called Action for Global Health, which does a lot of what we do as STOPAIDS. STOPAIDS is a network of about 70 UK-based international NGOs working on the global HIV response. And Action for Global Health does that, but for global health. And so we took that on last year, and then as a result of the COVID pandemic, suddenly that I think all of us working in health are very active, responding to both, COVID itself, but also the impact that it will have on our particular areas of focus, whether it be HIV or TB or but through Action for Global Health in particular, that's sort of been a really important focus, because Action for Global Health has landed up being the sort of coordinated convener for civil society here in the UK to connect with the UK government. And so I've landed up being on the steering committee of for the UK government, DFID, and civil society. And that's been a really interesting process of sort of trying to share good practice and convene across our sector what we're hearing from all of our partners in different countries around the world, so that we can share our intelligence about what the key challenges are, but also where we're being successful, where we can mitigate some of the worst effects of COVID and the impacts on the other health issues, as well as the secondary impacts that in many ways could have an even more devastating impact on people's lives in the countries that we're all focused on. So to your question, Aaron, about what got me initially involved in this work, initially, actually, I started work as a campaigner. It was sort of a real passion to sort of to work on international development issues, and it was in part by luck that I landed up working on HIV. I didn't have a particular calling in that direction, but what I realised very quickly working on HIV, which I've now been working on for, gosh, 17, 18 years, is that it sort of combined, I think as sort of TB does in many ways as well, sort of combined a whole bunch of factors, some of the most challenging aspects in society, human rights concerns, sex, drugs, a little bit of rock and roll, but lots of issues that you have to address in order to actually address HIV or to address TB. You have to address poverty, you have to address human rights, you have to address all of these concerns. So it certainly kept me passionate and focused on health issues since for all that time. So I don't know if that answers that question, Aaron.
No, I think that's great, Mike. It's always good to hear a little bit about where you came from. I love, people always smile the most when they're telling that part of their story at the start of the call. So it's great way to kick off. Really important to hear about that personal motivation. So look, we're going to take the usual set of prearranged questions before we open up the floor to everybody. For everybody that prefers to text in a question, of course, throw it in the chat box. Try not to flood the chat box too much, because otherwise I have a hard time scanning it up and down, but I'll do my very best. In terms of, you could also text or WhatsApp in a question. The number for that tonight is 0777 56 111 78. So if you want to text in a question, 0777 56 111 78. And of course, we'll do the old unmute and shout out as well at some stage for those that are on the phones. So you guys won't miss out either. I believe the first question of the evening is coming to Mike from Brighton.
Hiya, please can you explain the ways in which COVID-19 is disrupting the health services available to diagnose and treat people with TB, HIV and malaria?
Sure. Yeah, I think maybe I'll start just by sort of outlining how it can impact on the three diseases, or sort of what our worst fears are in how it can impact. And then also maybe I can go on to talk about some of the key challenges that we're hearing about. I was just on a call actually where sort of across health organisations across UK civil society were sharing some of these challenges, and then also just end on a slightly more positive note, hopefully, in terms of some of the mitigation and the things that we can do to address some of these challenges. So firstly, I mean, in terms of the impact that COVID can have, particularly on sort of the three diseases that we're working on, one of the biggest dangers is, of course, I think we all realize that we all focus on COVID. Everyone panics quite rightly about the danger, both health and otherwise, that COVID can impact on people. But meanwhile, as we do that, we take our eye off and our funding away from, and our attention away from the responses to these three diseases, for example, but all other health issues and other issues around the world. I mean, I think we've all seen on the newspaper, that's the only thing that's in the newspaper is around COVID. And so there are so many things just not getting the attention. What that means is that there are estimations have been modelling from a number of different key institutions, academic institutions. I think there was one referenced in your action sheet, modelling by Imperial College and other partners such as the World Health Organization, Stop TB Partnership and UNAIDS, that revealed that if we had, for example, like a 6-month interruption of services, it would have devastating impacts. So it does in your action sheet sort of cite the potential reversal of progress on TB by up to 8 years with an extra 1.4 million TB deaths. For HIV, the impact would mainly be in terms of interruption of antiretroviral therapy, but also in terms of people's ability to get tested and access a whole range of other services. And a 6-month interruption of HIV services in sub-Saharan Africa could return us to basically have the same number of AIDS deaths as we had in 2008. So that would be a return of 12 years of progress. And the same, very similar story in malaria. We would have up to a doubling in the number of malaria deaths in sub-Saharan Africa, returning us to mortality levels that we last saw 20 years ago. So potentially devastating impact, and actually in terms of numbers of deaths, way more than we could potentially see from COVID itself. So this is the horrible reality we could see if we take away resourcing. There are so we need to ensure that organizations like the Global Fund continues to have the resourcing that it needs. The fantastic replenishment that so many of you played such an important part in ensuring from the UK government. We need to ensure that governments like the UK honour their commitments to the Global Fund. And so far, thanks to continued advocacy, it does seem like everyone's clear that that funding needs to be maintained. But as the economic impact starts to hit, it's always a worry that countries who may have been worse hit, who did make contributions, are not able to honour those commitments. But also, of course, national governments, as they are hit economically, they're not going to be able to invest in health in the way that they would want to, or indeed invest in social safety net support for people in terms of the economic impact. So just to highlight sort of a couple of the key challenges that are preventing people from accessing services. Certainly we're seeing disruptions to supply chains already. We're hearing about this across the board. Country lockdowns are stopping medication and medical equipment from entering countries. They're getting stuck at ports or not making it to localities. We're also seeing disruptions to people's ability to access healthcare and medication. Clinics have had to close or restrict their opening hours due to lockdowns and social distancing. We're seeing that, for example, already here in the UK, where many people are not going to hospitals. So we're seeing, for example, in TB, that diagnostic tests for TB are being repurposed for COVID. There are potentials where you can ensure that those the tests are used together, but there is a worry that they could be diverted. And I think like deliveries of bed nets are also sort of being stalled. We're also seeing, of course, people's reluctance to actually even go and access services, even if they are available. For example, King's College were just sort of saying how they've collected data across 17 hospitals in sub-Saharan Africa, and they've seen a drop in 20%. By 20% of usage, and there's a real problem. So there's a real problem of lack of clear public health messaging to encourage people to attend hospitals and how to do so safely. There's of course a lack of adequate PPE, and health workers are being devastated, as we know, across the world. So even if people make it in, then there may not be the health staff there to look after you and to give you the services that you need. So there's no doubt that, you know, the COVID outbreak is, you know, for example, in HIV has contributed to challenges for HIV prevention. It's definitely deterred people from visiting clinics to be tested for HIV. So, you know, one of the other massive challenges that we're seeing also is the fact that the most marginalised are getting further marginalised and forgotten. Already at the start of the response to COVID, we saw groups that we know are some of the most affected by COVID itself: the elderly, disabled who won't be able to get access to services, and those with underlying health conditions are particularly in danger. And it's amazing how often they were missed off lists of the most vulnerable and people who should get particularly targeted with interventions. In sort of HIV and sort of TB world, those groups that are often the most marginalised and most impacted in HIV, you know, men who have sex with men, transgender people, sex workers, prisoners, and people who use drugs who are criminalised, they're even less likely to get access or to services. And we're already, you know, hearing many examples of where there are further crackdowns on human rights, and authoritarian regimes are using the excuse of COVID basically to just crack down on human rights and to arrest or prevent those that they don't like from having a voice or accessing services. So just to end my answer to this question, I think on a slightly more positive note, you know, I think the mitigations that we need to ensure are, of course, not taking our eye off the ball, the critical services for AIDS, TB and malaria, ensuring the Global Fund has its funding, but also crucially that there is greater coordination between disease responses and that we invest in health system strengthening that really underpins all of the responses. And combining services where possible. I mentioned, you know, the TB diagnostics, you know, ensuring that when people get a test for COVID, that, you know, also they might have a test for HIV, for example. We need to ensure that civil society is supported to reach the most marginalised. Often we're seeing, unfortunately, in a lot of countries that civil society are not being included in the governance mechanisms for the COVID response, and yet it's civil society who can do the most to reach the most marginalised and forgotten, as well as sort of ensuring that social protection mechanisms, when they may not be in place by the government, they can crucially be provided by civil society. So, and you know, also in sub-Saharan Africa, really looking at alternatives to lockdown, where so that people can actually continue economic activity, which is so critical to ensure that people don't fall into ever greater poverty. So I'll stop there, but there's much more I could say.
Thanks, Mike. No, very comprehensive. I was starting to get a little worried there, but then you started to talk about some of the things we can do and some of the positive stuff, which I think is really important for us to continually remind ourselves of, that no matter how tough things get, we have a path forward and work to do. So very good there. We're going to go over to Oxford for our second pre-prepared question.
Yes, hello. Thank you for taking time to talk to us. The question is, what is the Global Fund to Fight AIDS, TB and Malaria doing to respond to the pandemic and to protect services for the three diseases?
Great question, Tiffany. Yeah, the Global Fund really responded very quickly. I've been involved, you know, as board member for a number of years, and now in the delegation, and so was sort of got involved with the recent virtual board meeting, their first one. But already by that time, in May, when they had that board meeting, they'd responded incredibly quickly. They set up two distinct mechanisms for responding to COVID. The first one, the immediate one, was basically providing grant flexibility. So as some of you may be aware, many countries just started sort of applying for grants, new grants, which are supposed to be sort of starting this year. But the Global Fund immediately sort of said to all countries who had existing or about to start grants that they could use up to 5% of the existing grants to fight COVID-19 and to mitigate the impact that the pandemic is having on HIV, TB and malaria. And they allowed up to 5% of existing grants, which basically amounts to about 500 million US dollars. And they've sort of worked with countries basically to find grant savings and reprogramming. So to say, okay, what money aren't you using? What money don't you need, or could be reprogrammed in another way to channel to the COVID response, so they could really respond very quickly. That worked very well. We were very concerned as civil society that we didn't want that reprogramming to divert away from things that we felt passionately about, that were often sort of reprogrammed away from, things like human rights programming, etc. But the Global Fund was very focused on, no, it was only on things that could definitively be showed wouldn't be funded and programmed otherwise. So that was really good, an immediate response. The other response that they set up was what is now called the COVID-19 response mechanism, and that was an initial another allocation of about 500 million. So it brings to the total amount that they've diverted into the response to 1 billion. And this was additional funding that countries could apply for to mitigate the impact of the pandemic on HIV, TB and malaria programs, and make urgent improvements in health and community systems. So crucially, really making concrete investments in those systems that will underpin obviously the response to HIV, TB and malaria, but also the COVID response. What those two mechanisms have meant is that now in 84 countries and 6 multi-country programs, the Global Fund is now contributing funds to fight COVID. So eligible programs supported by the COVID response mechanism are around things like interventions to mitigate the impact, as I mentioned, actions to reinforce the response, initiatives to make urgent improvements in health and community systems, including laboratory networks, supply chains, and engagement with vulnerable communities. And I think, it's really ensuring that the learning and the focus on, the most vulnerable, marginalized communities is taken across to the COVID response. So the Global Fund is also sort of that's what it's doing in terms of its funding and its grants and its programs, but it's also taking a real leadership role in the global coordination, both collaborating closely with WHO, Gavi, the World Bank and others, and in particular through what they call the ACT Accelerator, and many of you will, I think this may be in your briefing also, is the main sort of global coordination mechanism led by the WHO, but then that has a broad facilitation group and 3 core pillars, one on vaccines, one on therapeutics, and one diagnostics. And they're working with other global institutions, and the Global Fund is leading on the one on diagnostics and also on health systems with the World Bank. So it's really playing an important role. And the last thing I'll say is I've been very pleased. We've been pushing them, but without needing to push very much, on the importance of civil society involvement in those global mechanisms, but also at the national level. As you know, many of you probably, the Global Fund has been critical at national level, is ensuring that civil society, and particularly the most marginalized communities, play a key role in governance, in deciding where money goes and how it's spent and how we track it and keep it accountable. And the Global Fund has played a key role in ensuring that civil society also gets a seat at the table with these global mechanisms, because it's only by having civil society and communities in these global coordination mechanisms that we can ensure that we get equal access to all of the services that we need through COVID.
Thanks, Mike. We've got one more pre-prepared question, only 18 minutes left on the call, so let's try and rush through that one if we can, so we get some time for questions from the floor. We're going to go to Linlithgow up in Scotland for the last question.
Hi, Mike. This is Bentley from Linlithgow. Why should the UK government provide additional resources to the Global Fund's COVID-19 response mechanism? Thanks.
Thanks, Bentley. Yeah, I mean, I've outlined some of the reasons already. You know that they responded really quickly, but you know I think the broader and they're doing so effectively. But I think the broader point, which those of you who have been active campaigning on the Global Fund for many years will be already know, is that the Global Fund has a incredibly impressive track record, having helped to save 32 million lives since it was created in 2002. It's well established, as we know. It's well partnered with other global health multilaterals to respond to infectious disease pandemics. It's had a lot of experience. And crucially, as I mentioned, it is sort of focused on those areas that are often forgotten. It is, a very effective global partnership, and it's one of the few global health institutions that really has, representatives from all of those key stakeholders who play such an important part in responding to health issues such as these, including, of course, civil society and communities. So really, it's no surprise that the Global Fund got the largest replenishment of any global health institution last year of 14 billion. But in order to respond to COVID, we can't just hope that it's going to repurpose funding for HIV, TB and malaria. Indeed, it would undermine, everything that we've been working for. So we know that we don't want to create necessarily sort of whole new sort of funding mechanisms because that would take a long time and we need to respond very quickly. And so the Global Fund is very well situated to basically be a channel and to do so effectively through national level, and crucially, ensuring that the responses are country owned, something that the Global Fund has always had a very strong principle on. And so I think it would be definitely an important mechanism. I think when we look back to where the HIV pandemic started, actually next year it will be 40 years ago that HIV pandemic started. It's interesting to sort of see how that it also started in and had the biggest impact initially in Western countries. And then it made its way to a devastating impact across, particularly in sub-Saharan Africa, but across the world, particularly in lower middle income countries. The danger here, and why I think we need to make the case for greater contributions from donor countries for the global response to COVID, is that we can't afford to let that happen again, because it will set back not only the work that we've been doing in health, but across poverty by decades. And we were already struggling to reach the 2030 targets as it was, but we would have no chance. So I think all of these reasons is why this action that you guys are going to be taking is critically important, why we need to persuade the UK government and other donors to just invest in the global response and to do so, and the Global Fund is a key mechanism for that.
Thanks, Mike. That's really clear, very passionate, and very good to have that connection to lessons from history. We definitely do not want to repeat those mistakes of the past. So Harriet is first out of the blocks with the question in the chat. So actually, why don't we go to that one first? If you do have any other questions, do feel free to type them into the chat box. If you're having a hard time finding the chat box, there's a button for chat in the bottom middle of your screen, and the box should pop up somewhere either to the right or to the left. You can also text through your questions 0777 56 11178, and we'll do a unmute and shout as well sooner or later. But let's go straight to the first question from Harriet. Harriet, do you want to speak it? If you can't get off mute in the next 2 seconds, I'll just read it out. Okay, I'll read it out. So Harriet says, Harriet asks, the Global Fund has proved its worth as a model. Is there value to be had in widening its remit to global health?
Oh, this is a killer question, Harriet, because I really I don't have the answer to that one. It's something. It is one of the key questions that is going to, I think, be perplexing and sort of grappling for most health advocates, and already is for many. The key challenge is that for all the reasons I just cited, the Global Fund is a mechanism. It's there. It's effective for everything that I just said. The real challenge, and we've long been having a discussion around whether Global Fund should expand to be the Global Fund for Health. The COVID crisis has only just sort of reignited that challenge, and it may be that at the end of this sort of crisis for the West, suddenly the donors turn around and go, oh well, Global Fund, you can just add another epidemic onto your list. So AIDS, TB, malaria, and COVID. That's quite possible. It's also possible that there are calls for the Global Fund to be a global fund for health across the board, because but one of the underlying challenges that many of us are concerned about who have been supporting the Global Fund for so long is that what it will land up being is the same amount of money, but just trying to spread it more thinly, which ultimately will undermine the response for AIDS, TB, and malaria, but also, not really deliver for other health issues also in the way that we might hope. So there is this real sort of conundrum, this real challenge. So, if the Global Fund is a mechanism that should be expanded, it can only be expanded on the basis that the donors step up and give substantially more money to be able to deliver what's needed. I mean, one last thing I wanted to just say on that is someone also sort of, it's interesting to note that I've been doing a lot of work on trying to ensure that other global health institutions, including WHO and others, actually have civil society and communities sort of on the board directing how these institutions operate. The Global Fund has that. And one of the benefits of the Global Fund taking on this role is that civil society and communities are already at the table. So that's one of the benefits there. But yeah, I think this debate will be raging for a long time, and interested to hear your thoughts.
Let's jump across to the question from Deirdre from Poole. I think it's a brilliant question. She writes, Mike mentioned improving health systems and infrastructure. Is there one thing which could make the most impact in any particular country? I mean, I think there are lots of things that could have lots of impacts in lots of different countries, but is there anything that sticks out to you, Mike, as being particularly impactful, or is it more just about the Global Fund's overall model?
Yeah, that's a tough question. Great question. It's what I'm going to fudge it a little bit, but by saying they're probably. I mean, it's nothing's jumping to mind for a particular country, but I mean, just by way of answering, I think it's interesting to note, for example, that it's not a identikit response from one country to the next. For example, in Kenya and Uganda, I think in Kenya, sort of 80 to 85% of people are below the age of 30. So sort of concepts of like using lockdown actually don't necessarily work for a country. It could have a massive impact economically, but so you might sort of look much more at a shielding approach, but sort of allowing people to, younger people to sort of get on, perhaps with a bit more social distancing, etc. So, but in terms of sort of health systems and infrastructure, one of the key interventions that I think really impacts, and I already mentioned this, but is really about linking and of doubling up on services where you can do that, and ensuring that people who have a particular health issue can then access other health issues at the same time. I know that even here in the UK, for example, my wife works in coordinating the response in Hackney. One of the things that the COVID response has enabled is actually sort of through the crisis, enabling the breaking down of barriers, the silos that so often constrain health services, but also sort of different, services for gender-based violence, services for mental health, breaking down the barriers so that you can actually create sort of access points so that people can direct people to a whole range of services, rather than just going, oh no, you can only access this service here. So, and I think that really is at the essence of building health systems, that you can connect people to a range of services. And the crucial last thing I'll say is the role of civil society and ensuring that communities and things like community-led monitoring can have such a fundamental impact on feeding back way up to national coordination mechanisms, to ensure that they hear straight away, within days, within hours, that services are not getting access to, that people are not able to access those services, or the quality of services are not there. So yeah, a few thoughts.
Thanks, Mike. No, that's great. And I think, everything that you were just talking about, it is actually, for those of us that know the Global Fund well, some of those things, I'm pretty confident that only the Global Fund can deliver that at scale, due to the nature of how it works. So it's really, really spot on there. Emily has put in the chat that she's read some really positive articles about how some African countries are leading the way in the response. I'm not expecting you to have clicked on that article and read it, Mike. I did while you were busy talking, but it's a wonderful Guardian article. It does talk about different African success stories in the response, in terms of the way that in many cases, countries that are, for example, used to dealing with Ebola outbreaks, they have a quite different response to when a new deadly infection comes along, to say, for example, countries with slightly slower responses. Can you talk a little bit maybe about anything like that you've seen in terms of how there's been some real leadership, and we're not talking about basket case Africa, or we're actually talking about a continent that is really taking positive action?
Yeah, I saw that article too, and it really prompted me that I'm super eager to gather those case studies together. We have been, as I mentioned, through Action for Global Health Network, have been I've created a database both to sort of highlight what the challenges that we're seeing, but also some of the success stories, and really collating those together as we speak. So definitely sort of eager for to pull those together, and we can, should be sharing those around. I mean, just I think the big picture, I'm sure if it was in one of those articles, but I did hear from one colleague that, just the transformation in the difference between, for example, them going to, I think it was Sierra Leone or Sudan, but they went in, they were, as soon as they arrived, they were channeled into socially distanced. They had a test. The whole sort of mechanism for how they entered the country really, showed the UK up for being way behind in its response, both in terms of sort of people coming into the country and those going out. So, I know Sudan, and those are the countries who, I learned from Ebola about just what it takes. And it doesn't take a huge amount of resources. It just takes leadership from those who are willing to listen to scientific advice and learn the lessons. It's been interesting on the meetings that we've been having with DFID. It's been good to hear that DFID have been very cognizant of the fact that we have to learn the lessons of the Ebola response. And one of those lessons really is that, you can't have these different responses operating in silos. So, you might have a humanitarian response, you've got the health response, you've got a socioeconomic response, but they have to be interlinked. Whether we'll manage to ensure that happens, but the good thing is that there are these stories in Africa where leaders, national leaders, are already doing it. So we should bring those together.
Thanks, Mike. We've got 3 minutes left, and I said we'd give people on the phones a chance to unmute and yell out a question. So let's do that now. Even if you're not on the phones and you want to unmute and yell out a question.
got one in the chat box about where does the WHO fit into all this?
Yeah, the WHO, I mean, as you all know, the US has sort of now pulled out insanely from funding it, which is more about Trump's obviously internal politics and his own agenda than anything to do with WHO. And it has been really reassuring to see the rallying of basically all other countries around the world in support of WHO, and the WHO is absolutely critical. And one of the challenges that it's had, which was sort of underlined with some of the previous responses in Ebola, for example, was just that it doesn't have the mandate in some ways that it needs in order to sort of insist on reporting from countries and then to take more control over sort of the response. So there's definitely mistakes have been made. There rightly, I think many countries are calling for an overall review across the whole response. But that's, I think all of us, all different member states and global health institutions are going to need to look squarely about how we respond to epidemics in the future. But for me, there is no question that the WHO has to play an absolutely central role if we are going to actually learn the lessons from previous epidemics, but also have some sort of central control and sharing of information. So yeah, I mean, it will be immensely challenging that the US has pulled its funding. Hopefully other donors will step up to fill that gap. And, hoping also, I hope it's okay to say on this call that come the US election, we might have a different president and therefore reinstate funding for WHO.
I think that's a non-partisan position, Mike. Well, let's call it that anyway. Given we're not Americans and can't vote, we're allowed to say things like that in the in the safety of this call. Look, I'm really, really sorry, but we've hit the top of the hour, and I want to be respectful of everyone's time because I know you've got busy evenings getting all organised to go and tackle your parliamentarians, and we've given you lots of reading and hopefully lots of things to think about. So I'm very sad that we're going to have to call it here tonight. I really want to say a big thank you to Mike for sharing all of his expert knowledge on the impact of the COVID pandemic on the 3 diseases that we all work on, and his thoughts on the importance of the Global Fund's particular work, its contribution to global health at this challenging time in the world's history. Mike, it's been so great to see the way that you can translate really up to the minute information on what's going on and bring it straight to our campaigners. So that's just been fabulous. And as always, we're going to be monitoring developments. We're going to keep everybody on this call informed on the best ways to use your voice in the current situation, trying to make sure that we can have the absolute biggest impact and influence that we can. Now, we don't know yet exactly how much additional funding the Global Fund is going to be asking for from donors to help deal with the impacts of COVID, but we do know the figure is going to be big, and we do know the figure is going to be one that's going to need support from people like all of you in order for us to reach it. And so, given that we know an ask is coming, the lack of an exact figure right now shouldn't stop you contacting your MP to make them aware of this upcoming opportunity to have a really powerful impact on the global COVID epidemic. As we've heard from Mike, there are few better ways that exist to move resources quickly to where they need to go. As soon as we've got more information about a specific ask, we are going to pass that on. And just remember, you are not alone in your advocacy. We also know that in Parliament, the all-party parliamentary groups on global tuberculosis, on malaria, and on HIV/AIDS, that's 3 of them, they're working together on a joint letter from MPs to the government on this really important issue. Again, we'll have some details on that soon, and we'll pass that on to you as well so that you can ask your MP to put their name to that, as well as contacting the Secretary of State separately. I just want to end tonight by thanking you for your continued advocacy actions at this very difficult time. You are all just incredible people who are standing up for a better world each and every month. This is exactly what our politicians need from its citizens right now, whether they know it or not, to help us get through the crisis. thank you so much for working in partnership with Results in this mission. Really looking forward to seeing you all again on the next Grassroots Conference Call. That's going to be the first Tuesday in July, which happens to be Tuesday the 7th. So it is good night from me. Thank you again to Mike. Thank you again to all of you. And I hope you can really enjoy the rest of your evening. Stay safe, everybody.
Thanks very much. Good night.
Thank you. Good night.
Thanks, everyone.
Thanks, everyone.
Thanks,
Bye then.
Bye.
Bye.
Good night, everyone.
Bye.
Take care.